Welcome to Creighton University in Omaha, Nebraska. I'm Dr. Anthony Bull. This is my friend the Skeleton, and here we're going to talk about the lower body and mid-body skin fold measurement sites today. In an earlier video, we looked at the upper body skin fold sites. Today we're going to look at the lower body skin fold sites to put together all the sites you would need to look at the Jackson and Pollock equations, both the 3 and the 7 site skin folds. Remember, previously we talked about the idea that we're going to try to pull the subcutaneous fat away from the muscle. Hopefully the subcutaneous fat measurement is not this large. We're going to need big calipers if that's the case. Trying to pull the subcutaneous fat away from the muscle so that we can measure the skin folds. Remember, the skin folds will be just above or superficial all the musculature. So for example, on the thigh measurement is halfway between the proximal patella and the inguinal fold, or the fold that's created when someone raises their leg. We're going to look at the superficial skin fold halfway between those two locations. It'll be right over the rectus femoris muscle. We're going to try to pull the fat away from the rectus femoris. Unfortunately, on the thigh measurement, many people have a condition that we just tend to call tough skin. Tough skin is a condition, we'll call it, where people have a little bit more connective tissue holding the superficial fat down to the muscle. We have a difficult time pulling that subcutaneous fat and skin away from the muscle and getting a good measurement. Unfortunately, it tends to overestimate the percent body fat for an individual, because instead of getting a nice fold that we can pull away from the muscle and underlying tissue, we actually get kind of a mound of skin and fat. And that mound tends to be a lot wider and therefore a bigger measurement than if we could actually get the subcutaneous fat and pull it away from the muscle and get a good measurement. So on the thigh measurement, which again, my friend the Skeleton is going to help us out here, the thigh measurement would be halfway between the proximal patella and the inguinal fold that is created when someone raises their leg on the anterior aspect of the femur, or just above the rectus femoris muscle. That thigh measurement is a common measurement in both the 3 site and the 7 site skin fold. One other lower body measurement that's not as common is the calf skin fold. The calf skin fold is taken at the largest circumference of the calf, which is usually in the upper third of the calf, the largest circumference of the calf, and we take a medial, the most medial side, we take a vertical fold on the medial side at that largest circumference. Most people don't store a lot of fat in their calves, so this measurement doesn't tend to be that large. It also tends to be one that you may have a little bit of trouble pulling the subcutaneous fat away from the muscle again. Be sure to warn your subject that it might hurt just a little bit. You'll try to minimize that. You'll try to be quick but accurate. But the better job that you do of pulling that subcutaneous fat away, the more accurate the measurement's going to be, or the better way to explain it is the skinnier they're going to look if you get a better measurement. So again, we have a vertical fold on the calf. We also have the vertical fold on the anterior thigh. Our other mid-body measurement, where we do have a vertical fold, is the abdominal measurement. A little hard to see here in my friend the Skeleton that doesn't have any tissue, but it's an easy one to pick out on your subject. The abdominal measurement is 2 centimeters to the right of the umbilicus, or the belly button. That's pretty easy to pick out. 2 centimeters to the right of the belly button. That's a little less than an inch. You can measure that site, a little bit of a mark like we've talked about before. Again, if you haven't watched the technique of skin fold video, make sure you watch that one. Here we're talking about the sites, but the technique is very important, and you need to watch that video to put the whole package together. 2 centimeters to the right of the umbilicus, we take a vertical fold. In many people, the skin will want to fold in that vertical way. In some people, and with some other equations besides the Jackson and Pollock, they actually ask for a horizontal fold at the umbilicus. It has been my personal experience, and I've done no research studies on this, but it's been my personal experience that taking a fold in the direction that the skin wants to fold in usually gets you the easiest measurement. Although if you do take the measurement in both the vertical and the horizontal direction, I tend to get almost identical measurements every time. Again, no research on that. Still follow the equation that you're using, follow their guidelines. So we have the calf, we have the thigh, we have the abdominal, and our other mid-body measurement is the suprailiac, above the iliac crest, suprailiac. The suprailiac measurement is taken in the anterior axillary line. I'm going to turn my subject, or the skeleton, to the side so you can see that. The anterior axillary line would come from the anterior armpit down, so from the anterior armpit down to just above the iliac crest. We want to go 2 centimeters above the iliac crest in that anterior axillary line and take an oblique fold. And the skin will really want to fold this way, so it's an oblique fold. Often this site is taken too far either back on the iliac crest or too far forward near the ASIS, or the anterior superior iliac spine. If you're that far forward, you're probably beyond or too far forward of the anterior axillary line. So you should be about anterior axillary line from the armpit, 2 centimeters above an oblique fold. Those locations, combined with the upper body locations we talked about on the last video, should give you the locations that you need. The one site that we didn't talk very much about was the chest skin fold measurement. And the chest skin fold measurement is usually taken halfway between, in males, halfway between the anterior axillary line and the nipple. In females, it's usually taken 1/3 of the distance between the anterior axillary line and the nipple. In our lab, we take that measurement in females about 2 inches from the anterior axillary line on the line of the pectoralis major. That is an easy way to estimate that measurement without having to measure the distance that's called for in most of the formulas. Again, if you are a male measuring a female, you want to make sure that you have another female in the room just to make sure that everyone is comfortable. And if your subject is not comfortable with you taking that measurement, you need to find a female colleague who can take that measurement for you. But again, that's covered in the skin fold technique video that you can see as part of this series. So again, the skeleton has been a great help. We used his friend's thigh to look at the thigh measurement on the anterior thigh. We're going to pull that subcutaneous fat and skin away from the muscle to get our nice skin fold. Again, we can look at the thigh measurement and we can look at the calf measurement on this model. The calf measurement is again in the greatest circumference of the calf, and it is in the medial side. So we want to take a vertical fold on the medial side at the greatest circumference of the calf. Finally, just to review one more time, muscle sinks, fat floats. When we look at all of this and we put them together, we want to be somebody who sinks, not somebody who floats. But again, watching the basic body composition video and the underwater weighing video will bring this point home a little bit more. All of these techniques are designed to estimate the density of the body. And from the density of the body, we use the general Siri equation to estimate percent body fat from the density of the body. This has been Dr. Anthony Bull here at Creighton University in Omaha, Nebraska, dealing with the situation of lower body and mid-body skin fold measurement sites. My friend the skeleton and all my model friends have helped me out today. We hope you come back and join us for some of the other videos in this series. Have a great day, and we'll see you in the lab.